Welcome, everyone. Thanks so much for joining us for our first registrant webinar on transition to the Health Professions and Occupations Act. With me today is Joannie Bouchard, who many of you will know. Joannie has been our HPOA transition lead and is continuing in that role, as well as she is currently our interim chief regulatory officer. And Joannie is going to be speaking to you specifically about bylaws today. I'd like to start by acknowledging that I'm in our Vancouver office today on the traditional and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples, and certainly very privileged to live and work from these lands. So with the next slide, please, Anita, we'll talk about the purpose of these webinars. So there's been a tremendous amount of work that's gone into preparing to date for the HPOA, and we still have a lot of work to do. But we thought it is important that we help registrants understand more about the HPOA and increase your knowledge of the complexity of this particular piece of legislation. And we will do our best to address common questions. Thanks to all that sent in questions in advance. We will do our best to answer some of them. Some questions were very much related to other aspects of the HPOA beyond governance and bylaws that we're talking about today. So we will ensure that the teams presenting future webinars get those questions and do their best to answer them. If you do have questions during the webinar, please put them in the question and answer feature at the bottom of your screen. And Michelle DeRoses, who's also part of our communications team, is going to be paying attention to those. And again, we'll answer as many as we can at the end of the webinar. Next slide, Anita, please. So our agenda today, I'm just going to do a brief refresher on the HPOA and share some information that you may or may not already know about it. I'm going to speak about governance, so board, committees in particular, and then Joannie's going to talk about the bylaws, so the process to draft model bylaws, college-specific bylaws, the consultation process, the feedback, and what we're doing next with all of that information. And then hopefully we'll have some time at the end for questions. Next slide, please. So the Health Professions and Occupations Act, or HPOA, will replace the Health Professions Act that we're governed by now, and it will become the new framework to direct how the college regulates health professions in the future. It received royal assent in 2022, and the in-force date has been set as April 1st, 2026. That was announced as part of the orders in council that were communicated in July of this year. It's been a long time in the works, and so we're very thankful that we have a date that we can actually work towards. We know that by April 1st, 2026, we will not be in full compliance with the HPOA. There's just too much work to do now, and some of it will be learning as we go along once this new piece of legislation is in force. One of the other changes will be new regulations for professions. They were also announced in July. We have a working group right now working with the ministry on the regulations in areas that we would like to see some changes or some clarification. And so we're not sure if those changes will be enacted before April 1st, 2026. We're doing our best to try and make sure there's clarity about regulations, title, scope of practice, restricted activities, certifications. But some of those changes might happen after April 1st, 2026, and that's really yet to be determined. This is a very complex and lengthy piece of legislation. It's quite unique in Canada. And so there's a lot of learning that we all have to do when it comes to understanding more about really this legislative framework. So what is changing and what is not changing? I'll start with the what is changing first. So the first is new oversight. The Health Professions and Occupations Regulatory Oversight Office has been established. That was referred to in the past as the Superintendent's Office. There is a superintendent that oversees this particular office, And within her portfolio is the Director of Discipline. And we'll speak a bit more about that in a minute. The role of the Oversight Office is multi-purpose. It's actually to deal with things like board appointments. It's to deal with complaints about the college. It's to determine performance reporting obligations of the colleges going forward. So they have a number of oversight functions. There are certain provisions of their authority that have been enacted to allow them to set up the office. However, until the HPOA is enforced, the superintendent and the Director of Discipline will not have full authority. So it's certainly new for regulators in health regulators, at least in British Columbia, to have that kind of oversight. Not unique to other professions such as those under the Professional Governance Act, but it's certainly new to us. There is a new set of guiding principles, and I'm going to speak to those in a few minutes, that are somewhat unique to this piece of legislation. There are changes in terminology. So, for example, we currently refer to registrants. In the future, the reference will be to licensees. There are changes to committees, such as the current inquiry committee will be the new investigations committee, or the current registration committee will be the new licensure committee. There is a new permit committee that's created under the legislation, and that committee is responsible for all things to do with health professions corporations. At the moment, that's specific to physical therapy and optometry, and it will actually include psychotherapy in the future. There is a new approach to discipline. So currently, colleges are responsible for managing complaints and discipline. Going forward, discipline will move to the Director of Discipline's office and be seen as part of that oversight function. There are a number of new programs and positions that exist under the HPOA. So program that you might have heard about, it was actually part of the Bylaws consultation, is support program, which is a new program to support individuals with allegations of sexual misconduct or discrimination. And so we are in the process of collaborating with other colleges on how are we going to set up a support program approach, who will provide support services, who will help people navigate the system, and who will provide counseling, which is part of what the obligation is with respect to that new program. And there are also a number of new positions that are created under the HPOA. So capacity officers, for example, or a capacity officer is someone that helps coordinate capacity assessments. There are new positions in quality assurance, etc. Also, the move from elected to appointed boards. This is not new for our college because we already have an appointed board, and I'll speak to the board in a few minutes. But certainly for other colleges that have currently a mix of elected board members and appointed government members, that is a significant change. And there will be new professions regulated under the HPOA. So our college will be the college regulating the profession of psychotherapy as of November 29th, 2027. And so we have already started ongoing communication with various interested parties within that profession. And we will continue our planning about how we're going to manage that transition, because there are a large number of clinical counselors, for example, that we will have the opportunity to transition in 2027. What is not changing? The college mandate. So we still have the mandate for protecting the public. I'll speak to that again under the guiding principles. Our board composition will not change. So the legislation dictates the board composition, which is 50% appointed registrants and licensees in the future, and 50% 50% appointed non-registrants or licensees. And so that composition is set out in the statute, and it will not change. Also, the ability for committees to work in panels. So currently, our statutory committees, so inquiry, registration, There's a large committee made up of members of all of the professions and also those public members, or what has historically been referred to as public members. However, they work in panels just to manage the workload and also just for administrative reasons. And so those panels will continue to function as they do today under the HPOA. Panel compositions, and this is a question that has come up repeatedly in terms of the actual composition of panels, particularly for inquiry, always have a majority of members from the designated profession under discussion. So the bylaws, the current bylaws and the future bylaws speak to the panel composition of at least two individuals from the designated profession and at least one from the public group within the larger committee, and that will continue. And many of the same authorities and expectations exist under the HPOA. And this is another misconception, is that there are so many new things that are happening under the HPOA. And there definitely are some new sort of obligations around accountability. But, we've had lots of comments about things like you will be able to audit records in the future. You'll be able to seize records. We can do all of those things now. But there is a difference between having legislation that enables a college to do something and actually the college using those powers. And so many of the same things exist within the HPA now and will continue to exist within the HPOA. Next slide, Anita, please. So what we don't know about our board appointments. As I mentioned, board appointments are now under the purview of the superintendent and her staff. We have a board currently that is made up of the maximum number of members in accordance with the legislation. So the legislation prescribes that the number of board members can range between 8 and 12. We currently have 12. I'll share more information about the board in a moment, but we don't know if that will continue under the HPOA or if they'll make different decisions about what our board number will be. The appointments will be as they were for the amalgamation purposes based on a competency approach. These board appointments are not representative of any profession. And one of the questions we get repeatedly is why are 3 professions not represented on the board? And it's because we have a maximum of 6 appointed registrants based on the legislation and based on what was approved at amalgamation. And going forward, we will have either 4, 5, or 6, both appointed registrants and appointed non-registrants. We are hoping that we will have some continuity between our current board and our HPOA board. However, that is really out of our hands, and it will be up to the superintendent's office to go through their process, make their recommendations to the minister, who will ultimately appoint the board. They are going through a process right now of actually reviewing applicants for board positions. They've had 2 sort of processes going on at the same time. One for existing board members who had the opportunity to express interest in continuing, and then for new potential board members to apply through an open call. And my understanding is that they are now in the process of reviewing all of those applications. They will go through an assessment process, an interview process, and then make their recommendations to the minister. We also don't know what the final costs will be with respect to the HPOA. And so as part of the work we've done around our budgeting process and also determining what fees should be, we have a placeholder in our budget for HPOA costs and really the future costs of regulation. But until we're actually under this piece of legislation, we will not know what the exact costs are. So for example, we don't know what the cost of support programs will be. We don't know what our volumes will be. We also don't know what some of the new expectations around reconciliation and engaging in anti-discrimination work, what those costs will be. So we've done our best to estimate some of those. However, I think they will have to wait until we have a bit more experience under our belt before we actually know what the costs of regulating in this new world look like. And we also don't know what the change to regulations will be. As I mentioned earlier, we do have a working group working with the ministry on regulations and trying to ensure that the regulations reflect current practice, and also hopefully what we would like to see in terms of future practice. Also, lots of conversation right now about what certifications mean and what that will look like. So we don't know whether those changes will happen before, after HPOA is in effect, or if they will ever consider our recommendations. Next slide, Anita, please. So the guiding principles, I wanted to spend a few minutes on these because this is somewhat unique to legislation, and some of these principles are very new under the HPOA and very much derive from UNDRIP and DRIPA in particular. So I think it's important for registrants to understand these because some of these expectations apply to you as much as they do to the college itself. So the first is to protect the public from harm and discrimination. Certainly protect the public is not new to any of you. That's been the college's role forever. This is just more explicit in terms of the discrimination provision in particular. The next is support and promote awareness of reconciliation with Indigenous peoples and UNDRIP and DRIPA as well as we need to take anti-discrimination measures. And we are trying to figure out what does this look like for the new college and what does this mean for registrants as well. So we will have a webinar in the future about discrimination and reconciliation just so we can share more information about what our thinking is. But this certainly applies to all of the work that we do. So as we're looking at policies, for example, we are thinking about how do our policies actually reflect these principles of reconciliation and anti-discrimination, anti-oppression. Be fair and transparent while respecting the privacy of individuals. And I'd like to really focus on the latter because this is another, I think, misconception that under the HPOA, the college will have the opportunity to violate everything we know about privacy and confidentiality. And it is certainly untrue. Certainly, we've heard lots of concerns about this, and I think we understand them, but I think I'd like to reassure registrants that we have no intention of violating confidentiality. The college is bound by many confidentiality provisions. I think legacy colleges and this college certainly respect privacy, and that respect is maintained under the HPOA. The next is to promote a holistic healthcare system that encourages collaboration between regulators and persons who provide services. So in the delivery of services, this is very much about team-based care. Collaboration between regulators. We do have now 6 regulators, health regulators in BC. We collaborate regularly. We have a lot of working groups that are working together about various aspects of things that apply to the HPOA. But we do have quite a collaborative spirit amongst the regulators. And I think that this creates some opportunities for us to look at how we can help support team-based care in the future. Identify and remove barriers to practice. This is very much about getting people into the workforce, so increasing the supply based on the demand. And certainly our licensure team will talk more about what they're doing to try and streamline licensure processes. But we are making every effort to try and actually improve the experience for people applying to the college and actually getting them up to speed for practice in British Columbia as quickly as we can. And the last is to act in a transparent manner and provide opportunities for meaningful public engagement. An example of this is the consultation that Joannie will speak to around the bylaws. But there is an expectation, I think this speaks to transparency and accountability under the HPOA, that colleges do engage in public engagement that includes registrant engagement as well. It's not external to our registrant population. So hopefully that gives you an overview of the guiding principles that, as I mentioned, are kind of unique for a legislative framework. The Office of the Superintendent, Sherry Young is the superintendent, and Benson Cowan is the director of discipline. And they have a new website, so the URL is at the bottom there if you're interested in reviewing any of the materials that they have on their website. So all about governance. So next slide, please, Anita. So as I mentioned earlier, we currently have a board that meets the composition requirements under the HPOA. That was intentional as part of the amalgamation project. They tried to align as much in terms of governance with what we knew would be in effect once the HPOA is in force. So we have 50% appointed licensees and 50% appointed non-licensees. They were competency-based appointments. There was a competency matrix that was put together by the governance team as part of the amalgamation project. And those competencies were then shared at the time with a Crown agency that deals with board appointments. They reviewed all of the applications. They made their recommendations to the minister. So again, there will be no elections going forward, and that merit competency-based approach is still going to be used. The merit principles that the superintendent's office is using are posted on their website. As I mentioned earlier, the size that's in the legislation ranges between 8 and 12, and it will be up to the superintendent's office to make a recommendation with respect to the size of boards going forward. I anticipate that they may vary across the colleges depending on what the college's needs may be, but we could have anywhere between 8, 9, 10, 11, 12 on our board going forward. Committees. So we have the board. The board has support committees, and going forward, the board will have 2 support committees. One will be governance and human resources, and the other will be finance and audit. So very typical board support committees. These are committees that don't have any statutory powers, but they do have oversight responsibilities, and they report to the board. We will have 3 statutory committees going forward. The licensure and investigation, so what are now referred to as registration and inquiry, they will continue. And we have this new permit committee that I mentioned will be responsible for overseeing the process to issue and deal with health profession corporation permits. And then we currently have the Professional Practice Standards Advisory Committee. This is a multi-profession committee that has both registrants and members of the public on it. And the purpose of this committee is really to provide that profession-specific expertise, but also be advisory to staff, to the board, to anyone who really needs to understand more profession-specific issues. We haven't had a lot of experience with this committee in the 18 months we've been around, but they have met and provided input into a number of profession-specific issues that we've needed advice on. So that advisory function will continue under the HPOA, and it is likely that we will continue to recruit members for that committee as we go forward. Next slide, Anita. And this is a new requirement that speaks to government, but it also speaks to that last Professional Practice and Standards Advisory Committee as well. So there is a requirement under the HPOA that the board must consult with professional standards and ethics advisors before approving any standards. And if the advice is regarding eligibility, so entry to practice requirements, for example, or practice standards, so they could be ethical or clinical practice type standards, the advisor must be a licensee who is authorized to practice the designated health profession to which the standards relate. And the other thing that's important to recognize is if the board chooses not to accept the advice of these advisors, the board is required to issue reasons for not accepting their advice. So again, it's that transparency and accountability focus of the HPOA. So we anticipate that we will continue to use our practice advisors in this role, as well as use others that have profession-specific expertise to provide advice in order to meet this new requirement. We do have practice advisors now for all of the 9 professions that we have, and we are going to look to add more in the future to fill a couple of the gaps. One will be a gap with respect to the new profession that we are going to be regulating as of 2027. So with that, I think it's the end of governance, and I'm going to turn it over to Joannie to talk about everything you wanted to know about the bylaws.
Thank you, Diane. Okay, so we wanted to circle back and go over the process that has happened over the last several months and then talk about next step 2 regarding having bylaw under the new act. So next slide, please. So the bylaw drafting process started in the spring of 2024. Moving under a new act means that the college needs to have new bylaw. The change are significant enough that we actually needed to draft a whole set of new bylaw. It wasn't about tweakings and amending the bylaw that we have now. So this work started in collaboration with all of the other colleges. So there were some legal counsel that were contracted in the spring of 2024. So that was before amalgamation, to draft what we call model bylaw. So model bylaw were a set of commons bylaw that were being compliant with the new act, that then each colleges were able to take and customize to insert the profession-specific requirement and also reflect the practice of the organization. So we received the model bylaw in October of last year, so a year ago, and then we contracted legal counsel to then customize bylaw that were going to work for the college. And so that work happened over the span of the last 12 months because we are in the midst of completing the bylaw right now. The approach that we took to customize our bylaw was to include what we refer to as the minimum. So best practice in order to have a flexible and agile set of bylaw was to not duplicating elements that already exist in the act, which is best practice when you write bylaw, and then also have the other layer that we call the policies that then work together with the bylaw in order to all three together represent what is the legislative framework for the college to operate. And as we had each of the bylaw part available, we went to consultation. We didn't want to wait at the very end to present a very big package to our partner, including registrant. So we published these bylaws as we went, and the consultation started in May of last year and was completed in October. I'll come back to the review of the feedback a bit more and how that was used. Where we are to now is that we are completing the bylaw to reflect the feedback that we received over the last several months. And we will present it to the board next week. And we'll also talk a little bit about next step, where we will post these bylaw for a final opportunity for registrant and other interested party to comment on. And the final approval will be most likely in March in order for them to be enforced on April 1st. Next slide, please. So this table is sharing with you lots of details, lots of number. Essentially on the first column, you see all of the bylaw section that together form the bylaw for the college. You see the date that the college posted this section, when the feedback was due, and the number of submission that we received. We were striving to have as much time as possible to be open for consultation. We ran out of time a little bit at the very end, but because we will be providing an additional opportunity for everybody to comment on the full package, we think that this will allow everyone to submit any last question, concerns, information for us to consider as we finalize the package. We got various engagement that I will speak a little bit more into the general details, but you see the total volume. We did receive the most for licensure. There were lots of feedback with the new requirement that the HPOA introduced regarding for colleges to confirm vaccination if there is an enactment or an order. Again, I'll explain this when we review the main themes, but this drove a big number of feedback for the college. So this is why you see this big number there. And of course, as the college introduced a new harmonized quality assurance program, this also generated lots of feedback and question. And this is where you're seeing the higher number of submission. Next slide, please. We also undertook consultation with Indigenous governing bodies. This is a new requirement under the Health Profession and Occupation Act. This work was done in consultation with the BC health regulators, so the other colleges in BC. And so we did that consultation. So Indigenous governing body only needed to engage with colleges once instead of 6 times. It was led by an Indigenous consultant, Harmony Johnson, who was the author of the In Plain Sight report. So far, we have gotten 3 responses, I believe even 4, as I saw an email about this yesterday. And we are remaining open if we have more Indigenous governing body that come to us. Next slide, please. So what did we do with the feedback? So I think that is a question that we have received a lot between May and now. And I can confirm that every submission that was sent to the college was reviewed and categorized. And I personally have read all of them. So all the feedback was reviewed and was categorized in 3 ways. If it was something we could actually action, meaning there was a mistake, maybe potentially with the listed accredited program for the college, we knew the change needed to happen, something that was a straightforward, yes, we need to change the bylaw, it was sent to the bylaw drafter. Second category was what we called potentially actionable. So that meant that leadership needed to have a conversation about it. Maybe our legal counsel needed to weigh in. Was that actually in alignment with the act? Was that something the college could actually change? Was there an actual issue that we need to address? And based on the outcome of those discussions, we determined what change was needed. Sometime the outcome was it was a bylaw amendment. Sometime it was a flag to maybe make a change or address the feedback in a policy. It could be at different places. So it was not always a bylaw change, but it usually led to something we could action as an organization. The third category is what we refer to as not actionable. This could be because the legislation is asking us to put this into bylaw. So it is not something we can change. It is what it is. For example, board size, board appointment process. It's not something the college can change. So it is not a change we could action into bylaw. It does not always mean we did nothing with it. Sometimes we have shared some of the feedback with other parties, whether it's government or the association. Sometimes we updated our communication on the website. So not actionable doesn't necessarily mean we did nothing with it, but it meant that we did not necessarily, it did not necessarily lead to a change in the bylaw or another document that will support the regulatory processes at the college. Next slide, please. Okay, in terms of general result, I will have a few slides to speak more specifically about some key themes we heard. First of all, most of the feedback came from registrant or licensees, and we also heard a lot from the association that represent your profession on almost all bylaw parts. We did get a little bit of engagement from the public, although it was not a majority, and also from a few other key partners. There were lots of very thoughtful comments, and it has been used to inform some changes. So we do want to thank everybody that has taken the time to send some feedback and read through these documents, as has definitely been utilized by the college. There was lots of feedback about requirements in this new act. So as I said, these things are outside the college control. The college doesn't write the legislation. We have to use it to create bylaws so that we operate under this framework. So a lot of these feedbacks were something we could not action upon. But we do understand that a lot of these things have created concerns or raise question for you. I think another conclusion we made out of the consultation is that, and I totally also share it, is that bylaws are hard to understand. These are not very simple documents for people to read through. And it led to some misunderstanding of what actually belongs in legislation versus bylaw versus policies. I did speak a little bit earlier on about the approach we took to write the bylaw, of making sure we don't duplicate what's already in the act, and also being mindful of how we can be agile and have elements in bylaw versus policies. Also, Diane spoke to, I think, what led to some misinterpretation of what was felt to be new rules or requirement when they already exist under the current framework of the Health Profession Act. And we saw how that is creating confusion and concern. And we're hoping also that the next webinars that we will host on specific topics will really help to address some of these questions that you guys have been raising with us. Next slide, please. Okay, so some of the main themes that we've heard, this is not meant to be an exhaustive list. So if you have provided feedback and you do not see your feedback reflected on there, again, it's not because it hasn't been reviewed or read or considered. I have just grouped some of the main themes, so some of the things that were repeated several times in the feedback, and being able to share back with you guys. So we have heard a lot of dissatisfaction with the removal of election. This is a big shift, I think, from what's been used for many, many, many years in regulatory bodies. But it is something that is required in the Act to move to a competency-based appointments that is under the superintendent. So it is not something that the college can change. There were some, not just concern, lots of question about what is going to be the appointment process under the superintendent. Diana spoke a little bit about this. It will be also a competency based process. Right now, if you go to the superintendent website, you will find more information. I'm not sure if the actual call for application is still open, but definitely they have provided information about the process that we'll undertake. And we're also going to share information as some of the decisions are being made for the appointment. The theme of lack of representation of all profession on the board was also something we heard a lot. Diana addressed it earlier. Just want to reiterate that under a multi-profession college, the board really has a role of strategic oversight, and the actual embedment of profession-specific knowledge is really at multiple levels under the board. The HPOA has also introduced the requirement for the board to consult with professional standard advisor when they have to approve a new standard. So it is a shift as to where the profession-specific expertise lies, but there's definitely not a gap because a profession is not represented at the board, because it is not the goal of having professional on the board. For committees, there was a few teams that came out. There was some requests, if now that the board was not going to have election, if registrant or licensees could elect committee members. Under the Act, this is something that the board have to approve, so it is not something that we can change. And the college usually do call out, also works with a competency-based approach process, so that information is available if you want to see how that process unfolds. There was also some requests to make sure that under the new bylaw, where we focus the recruitment and the minimum people on the committee to designated health profession, to ensure that we can still include school psychologists, which we will do. For public protection, so this is the section of the bylaw that is on complaints. There were lots of feedback on what people thought were new power or authority. For example, the ability for a college to suspend a licensee without notice, which is actually not a new power. This already exists in the HPA. It is something that the college would rarely, if ever, use. Best practice is really to ensure that there is a notice to the registrant before the suspension is implemented, but it is a power that is enabled in legislation, and it is not new. There were other questions and concerns with other powers, and we will again address these more specifically as we move into the the webinar on specific topics. Public protection is one of them. Licensure, this section of the bylaw had the most transformation probably. We did move to a profession-specific structure, to a what we refer to as task-based structure, so exam, renewal, reinstatement, and having what is profession-specific under the section. So that amount of transformation led to more error and omission. So we're really grateful that people flag all of these, and we are correcting them. An example was some schools were missing on the approved program, so we have made those changes. We have received some feedback on the removal of some licensure class. For example, non-practicing. We are working through individually with those licensees that are impacted by this change, and there will be further communication on this over the next few months before we hit the renewal in March. There was also some concerning confusion with the verification of vaccination requirement. As I mentioned earlier, the HPOA introduced a requirement for colleges to make bylaw that if an order or enactment, such as a public health emergency, that would lead to an obligation of vaccination for certain groups of people, such as health professionals, that the college has a bylaw in place to collect and verify that requirement. The college does not intend to have vaccination as a licensure requirement outside of this. So we are only complying with what the Act is requiring, which is to have this bylaw regarding as to us collecting this information when there is an order or an enactment by government. Next slide. More main themes, quality assurance and continuing professional development. As I mentioned, our new programs, the college is moving towards an harmonized program for all profession. This has led to lots of question and feedback as we are still developing those programs, so we fully understand that. There were lots of questions about privacy and confidentiality concerns regarding quality assessment. Diana spoke about the obligation of the college regarding privacy and confidentiality, and the legislation we are also bound to comply with when it comes to privacy and confidentiality. There is no significant changes between what was HPA requiring on the topic of privacy and confidentiality and HPOA. We do understand that QA assessment might be new to some profession, and we're really committed to share more information about how these will work, what will that mean, and how we will make sure that we actually protect privacy and confidentiality. There was some confusion regarding the reporting period versus the period to complete professional development. Under the continuing professional development bylaw, there's a section that says that people will be asked to report between October 1st and November 30th. This is not the period where you have to complete professional development. This is something you can continue doing throughout the whole year. This is just the time that the college will ask you to report on it. There was also lots of question on what the new quiz will be, and some of the registrar power under that section. The webinar for QA and CPD will be in January. We're just finalizing, picking the date and announcing it to you. We will provide a lot more of information. So if that is a topic of interest to you, please come to those webinars and send your question ahead of time. Two last things before I try to wrap this up and give it back to you, Diane, for next steps. Delegation, this was a term that was used very differently across all 9 professions in this college. So the HPOA introduces a new framework that we need to apply consistently to all professions. And so the term delegation versus assignment, I think, has created lots of questions. And especially, again, the fact that the term aspect of practice is now defined in legislation, which was also used differently by profession. So we will provide more information on this too. What I can reassure people is that we are not changing how professions are operating right now. And so you should not expect significant changes on April 1st about this. How these terms were used might just have been very differently versus how the legislation is now saying what these terms mean and should be applied to. Professional responsibility. We got some feedback on the restriction for provisional licensee only practicing in location. We will make some changes to that based on the feedback. We got lots of questions on the new harmonized standard, which we have just kicked the consultation. If it hasn't been done yet, it will, but I believe it was sent to all registrants. So you will have an opportunity to look at these and get a lot more clarification. And we also received lots of questions on what are the duties of the licensee and some of the timelines. We will review slightly that section, but also we'll provide more information to make sure this is clear to everyone. So, Diane, I wonder if you want to take that slide next and talk then about what people can expect in April.
Sure. Thanks, Joannie. So as Joannie mentioned, we are finalizing the amendments to the bylaws. The consolidated package will go to the board next week at their meeting for their review. It will not be for their approval at that point, but just to keep them apprised of what's happened through the consultation feedback process and what we've done with the feedback that Joannie just spoke of. And then we are planning to post the consolidated package for public review after the board meets. So not sure of the date yet, but at the end of November. And we're anticipating leaving the package up for consultation until mid-January sometime, recognizing the time of year. So there will be an opportunity for everyone to have a look at the consolidated package and provide any final comments. The regulations working group is working hard on certifications and what that will mean for the various professions. That will have to comply with some of the new certified practice obligations under the new regulations. And so there will be some updates required in the bylaws with respect to certification. And then the final approval will happen in the first quarter of 2026. Most likely that the current board will review the final package and then make a recommendation to the new HPOA board, which might be the same as the current board or it might not. We don't know yet. We have a project that has started recently to develop all of the policies that need to align with the bylaws. So as Joanne mentioned, our approach was to put the minimum in the bylaws and then to have a suite of policies that support what is reflected in the bylaws. It just makes us a little bit more nimble, even though we won't have the same consultation process under the bylaws as we do under the HPOA. It still requires quite a process to get bylaw changes. And so our drafting instructions to the legal team drafting these initially was let's put what must be in the bylaws rather than what might be nice to have and put all of those other pieces in a policy suite. We have a team working on the policies, and we're also looking at the guiding principles and trying to ensure that our policies reflect the guiding principles, specifically some of the new guiding principles that I spoke of. So that's with respect to the bylaws. By April 2026, the bylaws will be in force. We'll have some key policies in place. We know that there is a lot of policy work still that needs to be done, but we will have certainly those key regulatory policies in particular, those that are really important for licensure, for inquiry, and for quality assurance. And we know that there will be ongoing work to ensure compliance. None of the colleges expect to be in compliance on April 1st. I would say that the majority of colleges aren't in compliance with every last piece of the current legislation, the Health Professions Act, but we certainly are working to make sure that we have all of the core pieces in place by April 1st. Next slide. So we're going to host webinars between now and March. Anita, next slide. The next one is on December the 10th, and it will be the licensure team that will talk about changes to licensure. And then the topics that we've identified so far are quality assurance, CPD, delegation, discrimination, and all of those anti-discrimination requirements, sort of human rights issues. We thought that might be, well, it certainly is relevant to what registrants need to know, but might be interesting to proceed with that before we talk about complaints, discipline, and support programs, and then harmonized ethical and practice standards. If registrants have suggestions for additional webinars or other topics related to the HPOA that you're interested in, we are more than happy to hear from you, and we'd be happy to add webinars to this. But this was the initial list that we came up with around the core topics that we think are important for you all to understand more about. Next slide, Anita. I think that's really at the end. And so we have a few minutes for questions. I know, Michelle, you've been having a look at the questions, so maybe you can let us know if there are a few to start with.
Certainly. Thank you, Diane. There were a few questions that we received in advance through the survey. And so for those of you folks on the line that will be attending the licensure session, I would encourage you to go to that survey that we sent out if you have any questions for the licensure session. We'll be using that feature for subsequent webinars that we do. So the first question I have here, Diane, that was received in advance is, why are not all professions represented on the board?
Well, I think I spoke to this in the governance slides. So we currently regulate 9 professions. We will be regulating 10 professions as of 2027. And the maximum number of appointed registrants we can have currently under our current structure is 6. And so automatically there are 3 professions that are not represented. If our board size is reduced, there'll be even fewer. But I think the bigger issue is this board, and Joanne mentioned this, is not a board. It's not a representative board. It is a competency-based board that is focused on strategy, fiduciary duty. It is not there to deal with profession-specific issues, which is quite different than in legacy colleges. So there are really 2 things. One, the purpose of the board is governance. It's not operations or profession-specific matters. And the other is that we are in compliance now with the maximum number of registrants that we can have on the board based on the current composition.
Terrific. Thank you, Diane. Next question received in advance was, how is profession-specific knowledge embedded in the college's governance structure?
Thanks. So I think we touched on this as well. I think there's 2 places. One, the practice advisors that we have in place represent each of the professions that we regulate. And so they provide profession-specific knowledge, not only to registrants and less so to the public. We get more inquiries from registrants, and that's really their role, is to help support registrants understand regulatory obligations. But the other is through the Professional Practice Standards Advisory Committee, and then also by having representatives of the registrants on the various statutory committees. That's why they're there. They bring that expertise to the decision making that those statutory committees are authorized to do. So that's really the structure that we have in place.
Thank you. Next question. I find there are a lot of details missing in the bylaws. Why is that?
I think again we've tried to address this, and that our direction was, let's put what we must have in the bylaws based on the model bylaws that we were provided with, but also what is fit for purpose for our college, and then the rest will be in policy. And I know, I don't know, Michelle, if you received this question, but I know I have been asked in the past, well, will we post the policies on the website, for example? And we certainly have no intention of not making policies transparent, but a lot of them will be operational policies. Happy to share them if people are interested. But the policies that we will post on the website will be things that are really important for applicants or registrants to know. So it could be something like if we have an English language proficiency policy or a substantial equivalence assessment policy, that those will be on the website and available for anyone. But certainly we have no intention of hiding policies from anyone. If anyone is interested in the suite, we'd be happy to provide it. But right now we're intending to post policies that are really germane to applicants and registrants.
Thank you. I just want to be mindful of time. We do have a number of other questions here. We can circulate responses to those questions after the session. And there are also a number of questions here that don't relate to the topic at hand today, but may relate to some of the quality practice or licensure webinars that we have coming up. So we will triage those questions over to those sessions. But maybe, Diane, if I would suggest, because of time, we can end the questions at that point.
Great. Well, thanks, everyone. Thanks, Joanne, for being with us today. Thanks to all of you for joining, and we look forward to having future conversations with you about the HPOA. Have a great day.